I was literally on the brink of suicide because everything was really moving in a bad direction.
Suffering from a spinal cord injury, I tend to have pain.
I was really closed off, and I didn't talk to people. I was very isolated on purpose.
I could barely walk, move around. I was constantly medicated with other oxycodone and other meds.
Alpine Health Wellness is a rather unique medical practice that is geared toward helping patients who have particularly challenging pain conditions. Ketamine infusion therapy can treat a wide variety of conditions. Most commonly, it does treat what we call neuropathic or nerve-induced pain conditions. So CRPS, or complex regional pain syndrome, is one of those conditions, but there are other neuropathic pain conditions.
I have complex regional pain syndrome, which I got from a surgery in 2012. The doctor cut my sural nerve in my leg, and that left me completely disabled with really bad pain that's started to spread through my body.
I had neuropathy in both legs and post-herpetic neuralgia in my tongue from shingles.
I was kind of bummed out before I had the ketamine and depressed, and I'd have my moments, of really hard times.
The pain was bad. Well, it is, I mean, it's better now, but the pain was really bad. Plus, after 10 years, you have the depression from pain and stuff like that.
I didn't have any treatments that really seemed to help the pain with complex regional pain syndrome.
I pursued undergoing ketamine therapy because I was in a lot of pain and not happy with the treatment that I was currently taking.
At the time, I was on extremely high doses of fentanyl, and I was also on oxycodone, and kind of had maxed out efficacy. And so Dr. Kesten had recommended ketamine treatments for me.
Other treatments that ketamine infusion therapy can be helpful in treating are fibromyalgia, nerve root impingements of the neck or low back, and even certain mental health conditions such as treatment-resistant depression, anxiety problems, obsessive-compulsive disorder, and other conditions which simply aren't getting better with traditional treatment.
Before I started ketamine, I also had depression from my pain because I could not do very much, and I've always been an active guy.
10 years ago, I had a knee replacement, and it kind of went from there. So I did the ketamine to help with the pain, to try to see if it could help maybe reduce the pain or how I felt the pain different.
In 2004, I was in an auto accident that left me living with quadriplegia and with a traumatic brain injury.
We were specifically targeting the neuropathy, the post-herpetic neuralgia, but also trying to get a stasis for pain management.
It's really important to realize that ketamine is not, in fact, an opioid. It is not a narcotic. So, in fact, it's not addictive. Ketamine binds to a particular receptor. Cells have receptors that are very, very specialized to particular molecules such as ketamine. Ketamine binds to these receptors not only in the brain and spinal cord, but also in what we call the peripheral nervous system, and that's essentially the connection between any part of the body and the spinal cord or brain.
Ketamine infusion therapy has helped reduce my pain so much that now I don't take pain medications at all.
Ketamine therapy did improve my quality of life.
My pain's been greatly reduced. I'm able to exercise a little bit more regularly. I can go on walks. I can be active with my daughters.
My mood has been absolutely fantastic since I started ketamine. My pain has been largely reduced. I'm down to one narcotic now instead of multiple narcotics. And I feel like the ketamine has been a real game changer for me.
We like to customize the infusion experience per the patient's request. Some patients like to light candles. Some patients like aromatherapy. Some patients like to listen to music, while others might like to watch music videos during the infusion.
They knew how to make me comfortable. We turned the music on and just went for it. So every day that I had to go deeper, it got easier.
The structure of our practice by design is very different from the majority of practices elsewhere. For one, we spend extraordinarily large amounts of time with our patients, and we have a staff that's also dedicated to that mindset.
During the infusion therapy, patients will always have a one-on-one licensed medical professional with them during the infusion, from start to finish.
We have one patient success story that's been particularly gratifying to us. This gentleman had undergone 26 arm surgeries and came to me on large doses of pain medications. After undergoing his initial ketamine infusion induction, meaning his 10-day course, we were able, after 60 days, to eliminate his absolute exposure to pain medications. He's regained his quality of life. He's able to do things on the home front, relate with his family and friends, and he is just so grateful for the opportunity to have this treatment performed on him.
I believe that ketamine has improved the quality of my life, which in turn improves the quality of life of those around me.
Ketamine has actually improved my quality of life and has made my relationship with my wife and kids unbelievably better.
My quality of life has absolutely improved 100%.
If it wasn't for Dr. Kesten and Kristen, I would still be that guy on pills, not doing anything with his life. This has given me my life back.
I would highly recommend it to anybody who's got the CRPS or even the depression, because it helped a lot with that.
Dr. Kesten is family to me. I wouldn't consider going anywhere else for my treatments.
They really care about their patients and are very concerned about the experience and making sure that you're getting what you need.